Hello, welcome to RSI Help YouTube. So somebody asked me why their shoulder blades were hurting and what they could do about it. So here to answer that question is a frequent guest on RSI Help YouTube, Dr. Nik Vizniak of Pro Health Systems in Vancouver, Canada. Dr. Nik is a professor of anatomy, the author of many books, and he's a clinician. So Dr. Nik, what would you say to somebody? We were talking earlier and you said that it's complicated, that shoulder blade pain could mean many things. So what are some of the things that it could refer to?
All right, Devil. Well, thank you for having me. Yes, shoulder blades are very complicated. If you actually want to look at the anatomy, I'll spin this around here for 1 second for you. But at the end of the day, there are over 17 muscles that attach to one scapula. So that means it's not like a regular joint. Most joints, you have a bone and another bone fits into it and they move back and forth. No way. The scapulas are suspended in muscle. If you want an example where you might actually see this, is watch a cat or a lion on a nature documentary. When you see them moving, you see those shoulder blades rocking back and forth like this as they're moving in towards their prey or whatever they're hunting. That means the scapulas have to be coordinated to carry half the animal's weight or more up and down at the front. For us, it's a very complicated issue to figure out exactly what the problem is around the scapulas.
You know, it almost reminds me of a sesamoid bone.
Well, there's lots of different sesamoid bones in the body, like the patella. There's some on your thumb, on the bottom of your big toe. But actually, the word sesamoid is sesamoid seed. It actually is kind of a rounded shape like this. It's a bone floating in muscle, usually only one muscle or tendon, like the quadriceps tendon for the patella. But in this case, it's suspended by literally 16 or 17 different muscles, depending upon your own anatomical variation. So a disruption in the major players can have a significant issue on that. If you want a video where I can show you some abnormal scapular movement, if you just go in and type in Vizniak winging scapula on YouTube, you'll see a video of a former patient who had that. You can see his scapulas move totally inappropriate to each other because of some nerve damage they had actually had previously from a wakeboarding injury that occurred.
You know, before we move on, you're bringing to mind that analogy that you used with the cat or the lion, balancing the weight between two scapula. Very often you'll see people in a yoga pose where they're just hanging. They're not actually using their ground forces.
Yep, absolutely. So if you see me teaching any yoga classes, you'll see that we do an upward facing dog, but I'll actually do an upward facing dog. I'll do it on this chair really quick for you. I'll do an upward facing dog, and you'll see people will get set up, and what they'll do is they'll drop into it like this. So you see their shoulders are way up here.
Yeah.
Yeah, the cue is your shoulders aren't earrings. You want to bring yourself up and then control the position that you're in so you have good balance all the way through that. Exploring this range is okay, but just not dropping into it like this is what we're trying to avoid.
Yeah, I think there's a lot of shoulder injuries from improper yoga technique. But let's talk about the origins. You were talking about shoulder blade possibly referring to cardiovascular.
Well, so as a physician, one of the key things that I have to do is when you first come into my office, I have to decide, because the heart, the aorta, all the structures in this region, the chest, can also refer to the back. So we have to make sure that there's no more significant injury happening, where it could be a mild heart attack or something else, pulmonary embolism. Name the condition of the cardiovascular system in the chest, and it could potentially show up there. How do you know it's a repetitive strain injury? Chances are you can initiate movement that changes how it feels. So you're like, oh yeah, right here I feel it. No, not so much. Oh, and then I can feel it really pinching right there. The other common thing that a lot of people don't realize is directly below your scapulas are all the ribs. So if, again, you're looking at the skeleton, you can see the ribs below the scapula. If one of these ribs isn't right, or if one of the muscles below it is into spasm a little bit, it can throw things off as well for the scapula. So for a lot of people, mobilizing these ribs and the thoracic spine makes a big difference. And a great way to do that is foam rolling.
So you would lie on a foam roller and...
Yep. You'd lie on a foam roller, and I give it as one of my key things because so many patients, especially when you get into geriatric patient populations, so many patients, this is how they spend their day and they can't straighten out. Well, if I can put behind your back a little wedge or a foam roller, and I can make you lay back on it, I can force you into extension to open up your chest and open up your shoulder blade motion. And that is huge for people when they're having, I mean, even down here, having difficulty breathing, lack of mobility. And again, those scapulas have to slide over top of all that structure.
So in terms of reasons why people would be having issues with their shoulder, what would the top one be? It sounds like it might be postural.
Yep, it's postural is definitely related to it. It's postural and fatigue from lack of exercise and strength flexibility training. Most people today are not moving enough. If we can just get you moving, you're going to see most of your symptoms are going to resolve.
Well, I think that's really good advice for just about any topic that we would be talking about. I mean, the movement and getting the blood flowing is enormously healing, and also keeping tissues healthy.
Yeah.
I want to thank you for coming on to the show again, Dr. Nik, and we can't wait to have you back on. Anything else you want to add?
Nope, just get out there and move those shoulders, live life, get your hands up, and be proud to be who you are.
All right, well, thank you for coming on to the show. Thank you everyone for watching, and please subscribe.